It's amazing to see so many people here. Welcome. I'm just going to sort of try and set the scene with a few introductory slides and maybe a few quotes. Some of you might have seen these already, and then we'll move on with the main program. I suppose it's probably fitting to start with a definition of what really should be called the epilepsies rather than epilepsy. The sort of most substantive textbook of epilepsy in the world is a 3-volume textbook, and it is called The Epilepsies to reflect that. So basically, epilepsy is a group of brain disorders that can affect anybody. Both sexes roughly equally, maybe males slightly more common than females, but essentially equal. Any age, and there's this sort of myth that most individuals with epilepsy begin their epilepsy, or their epilepsy begins to affect them in childhood, and that every person with epilepsy has seen somebody like Professor King or one of our pediatric colleagues. But in fact, there's a second, but it can start at any age, and there's in fact a second peak of new onset epilepsy in more middle-aged and elderly individuals, which has become more of an issue because obviously people are living longer. So there is a second peak of new onset epilepsy in elderly, so any age, and it's characterized by the occurrence of recurrent unprovoked seizures, although they may be provoking circumstances in individuals. Or the sort of definition of epilepsy has sort of evolved in the last number of years, and we now think about epilepsy as maybe have an individual who has had one unprovoked seizure, but by an in-depth analysis appears to have an enduring predisposition to further seizures. So by that I mean an abnormality on the EEG that would reflect the risk of further seizures, or an abnormality on a scan that would predict the occurrence of further seizures. So sometimes we will now treat epilepsy after the occurrence of one seizure if the investigations are abnormal. Epilepsy, particularly difficult to control epilepsy, may have significant consequences in terms of these issues. I won't read through the slides, you can read yourself. But we also have to say that 2/3 of individuals' epilepsy can be well controlled with the appropriate treatment, the appropriate medication, and there is no reason why somebody with well-controlled epilepsy cannot have a completely normal life. And of course, people with difficult to control epilepsy, the goal is to have a normal life as well, but obviously that is more challenging. And about 1/3 of people are said to have difficult to control, or what we might call drug-resistant epilepsy. This is a quote from nearly 2,500 years ago from this wise gentleman Hippocrates, who was a Greek philosopher. And this could be basically said today as well. So he said that it seems to me that the disease is no more divine than any other. It has natural causes just as other diseases have. Men think it is divine merely because they don't understand it. But if men called everything that they don't everything divine that they don't understand, then there would be no end of divine things. So we still don't understand lots of issues surrounding epilepsy, and that's why epilepsy research is needed, and that's why we'll be discussing later on in the evening. I meant to bring this book so I could kind of hold it up for effect, but I left it in my office because my head's all over the place today. So this is a great book. It's the subtitle, well, the main title is The Spirit Catches You and You Fall Down, but the subtitle is a Hmong child, which is an area of Asia which I think is north of Vietnam, and a lot of these people went to I think Colorado as refugees, and there's a big Hmong community. If one of you is, the community is in one of the Clint Eastwood films. I don't know if you've ever seen it, I can't remember the film. It's about the car that Clint Eastwood is. But a Hmong child were American doctors, and the collision of two cultures. But it is a really good read, written by this journalist Anne Fadiman, and it sort of highlights people's different perceptions of epilepsy and the different cultures and the clash of Western cultures and Eastern cultures. And that's a quote from it, but again, I won't read through it, but I'm just highlighting the book. But if you are interested, I would really recommend it as such, and it is available on Amazon, and I have no shares with the publisher. This is nearer to home, and some of you will have seen this already, and this is a very Peter is a friend of mine. He's a Dublin poet. This is in the public domain, so I do have his permission. I mean, this is an essay he wrote about his own epilepsy, published in the Dublin Review a number of years ago. Peter has a form of epilepsy called juvenile myoclonic epilepsy, and As I got older, I refused to take the most rudimentary precautions. I stayed up late and got up early. I drank with abandon. This had bad consequences. I collapsed at parties. I fell in showers and baths. I had seizures in girlfriends' beds that I wouldn't hear about for months. That part should be censored, of course. Sometimes at night after drinking, I'd start having bouts of unconsciousness as I was talking to somebody. I'd give a little gasp and could feel myself slipping out and then coming in a few seconds later. This could cause consternation and bafflement in the person I was talking to, and was to me more disturbing than a total loss of consciousness, because I could see it happening and knew from experience that it might escalate into a big attack as a convulsive attack. But it's a very interesting essay and a very exquisitely written essay about his own epilepsy. Okay, just to finish the sort of introductory remarks, I think why we need epilepsy research is fairly obvious to everybody in this room. As I've already said, the causes of actually much more than half of people's epilepsy is not understood, and in fact the cause of most epilepsy is not understood. So, for example, a lot of temporal lobe epilepsy is caused by sclerosis or scarring in the part of the temporal lobe called the hippocampus. So we can say on one level, well, that's the cause of this person's epilepsy. But okay, if you take it down to the next level, well, what's the cause of the scarring in the hippocampus? So if you go down to the micro level, in fact, most causes of epilepsy are hardly understood. Various organizations have supported epilepsy research. I put this up because it's obviously a nice acronym. This is an organization in the States called CURE. Some of you are probably familiar with this organization, Citizens United for Research in Epilepsy. And basically CURE are to the United States as Epilepsy Ireland, or in Ireland, Epilepsy Ireland obviously support, and we've been very appreciative of their support in research in Ireland. And this is kind of their sister organization, if you will. To, obviously there's other organizations like the Epilepsy Foundation of America, but that support epilepsy research. We know that treatments are often ineffective. If the first drug we tried was effective, then that would be great, but that is no way the case. And of course, also treatments can have many side effects. The value of epilepsy research obviously leads to a better understanding of the underlying processes within the brain that lead to the development and expression of the epilepsies. By its very nature, scientific and medical and clinical scientific research is a sort of I consider a slow drip progress. We make slow advances, and there are slow advances in the community. Occasionally, there is more a quantum advance, which can make much bigger differences to people in general. And of course, what might be looked at in the community as minor advances could be a huge advance or a huge benefit to a small number of individuals, and we will be given an example of that later on. But an example, obviously, of a quantum leap advance would be the development of MRI in the late 80s, early 90s, which helped us to understand at least the structural correlates of epilepsy. Okay, so I'm not really going to talk through this slide, but there is many ways in which epilepsy research is funded, including international funding from the European Union, national funding from organizations like the Health Research Board, which is government funded, patient organizations I've mentioned, like Epilepsy Ireland. We would also, of course, like individual fundraisers and donations. So if you feel like doing a table quiz or any other fundraiser for epilepsy research in Ireland, that would be fantastic. One of the things that has been very poor in medicine in general in Ireland over the years is this concept of philanthropic funding for research. It's huge in the States. I mean, some billionaire gets a building called after him if they give lots of money, and that's fantastic, but we don't really have that in Ireland. Maybe one day we'll track down Dennis O'Brien and force him into a corner, but it really hasn't been, within the medical community, hasn't been a big issue, a big benefit in this country. Okay, so I'm going to stop talking for the moment, and I'm going to introduce my colleague Gianpiero Cavalieri, and he's going to explain to you how genetics can help us better understand epilepsy. JP, thanks.